There we go.
Okay.
Why don't you describe Allies to me for someone that doesn't know anything about it?
Allies for Health and Wellbeing is a nonprofit. We're one of the first AIDS-centered organizations in the country.
As medical advancements and treatments for HIV and AIDS has improved, we have expanded and evolved our services.
We have a clinic, we have a pantry, we have a pharmacy.
We see people from all walks of life, and we just provide a very patient-centered care for anyone who wants to see a physician or provider in our agency. Nonprofits do rely very heavily on using employee benefits as a tool to attract and retain top personnel, just because often our salary ranges might not match those in the for-profit world.
What we can provide them is, one, a work-life balance, and two, really good benefits.
We had very good healthcare, and we were very lucky to have such a great program that was provided through our employer compared to many other places.
About 2 years ago, we were hit with a renewal increase of 44%.
There was no phasing out of it. It was just like, boom, here you go. And you've got to make hard decisions.
We were working to come up with any kind of solution that would not slash the benefits that our employees, some quite literally, rely on to survive. I was not sleeping well, just pulling my hair out, trying to figure out a way forward that didn't hurt anybody. It was our broker who said to us, there's this thing called an ICHRA.
Allies sits in one of the hardest segments that we typically operate in. They're in that 50 employee to 150 employee segment where they spend a lot of money on healthcare, and oftentimes they get an annual increase that is not necessarily always justified by the carrier. Once that starts, it's very, very difficult to recover. ICHRA changes all of that. Now you've got all these different choices and all these different carriers out there.
Okay, if they're saying that this can help us, let's give it a try. There was a bit of skepticism and maybe some fear that our employees were feeling at the beginning.
When I initially heard about ICHRA, for me comes anxiety, like change is coming and it's coming quick.
I'm not going to lie that the implementation of the ICHRA was a rough period. We actually set up meetings with third-party administrators who would provide the platform that our employees would use to purchase the insurance and handle the administrative aspects.
Take Command is one of the largest ICHRA vendors that is out there.
We were very busy. We had to do a lot of employee education. Take Command offered us a lot of materials to share with our staff, and then we also had virtual calls.
It's personalized. Like you are not a number. I am Crystal McKee. She knew my name. I told her what I was looking for. She understood my concerns, and she walked me through to make the right choice for not just myself, but for my family also.
We were able to provide a subsidy to every employee that would allow them to choose on the marketplace a gold plan or higher.
We can choose what is best for us. Not every employee is going to have the same health needs, therefore, why would they all have the same insurance?
Being able to use the ICHRA has really kept Allies a vibrant part of this community. In the first 2 years, based on the projections of our last renewal, we will have saved about $1.2 million. For a small 50-person nonprofit, that's a huge number.
We've been able to use some of that fund to weather a massive cut from the state. If you are a nonprofit, I would say ICHRA is a great solution, especially if you're small like we are.
I genuinely talk about ICHRA with my friends personally. I'll say hey, I hear you complaining about your health insurance. Maybe you should tell your HR team to look into an ICHRA. Might not be the right fit, but it's worth a few hours of research.
We pride ourselves in that our clients make an educated decision on how they fund their healthcare. ICHRA is part of that strategy.
It's nice to have the freedom to choose what is best for you and your health.
I know when I go to my appointments that everything is covered. I feel good.
I think for a nonprofit, it's an extremely beneficial tool to be able to maximize what you can give your employees, but still be affordable for your budget. So of all the choices out there, ICHRA for us was by far a no-brainer, the best.
Amazing. Thank you.
You're very welcome.